You are here on purpose with a purpose by design. Hello and welcome back to the Pamela Show, where we do what? We learn and we grow together. As you already know, we are on location today in studio with my very good friend and chiropractor of 20 years. He has been my health coach, my wellness coach, fitness coach, and someone that I have come to trust in many areas of my life, medically and otherwise. So I am excited that you're here today. Get your paper and your pen because you're going to need it to take notes. It's going to be lots of gold nuggets being dropped everywhere today. My friend and chiropractic care doctor, plus much more. Dr. Terry Drassal is with us today, or we're with him. We're at his office. Thank you, Dr. Terry, for being with us today. And I know I've been excited. We have been looking so forward to this and been planning it for a long, long time. So would you tell us all, who are you?
Well, I'm Dr. Terry Drassal, and I grew up in St. Paul, so I'm a Minnesota native. And quick background on me is how I got involved in chiropractic. Basically, it started when I was in high school. I was playing football, and I got a back injury. And my mom and dad had been seeing a chiropractor for their back, and I thought, well, I don't need any of that kind of stuff. Well, now my back is bad. I can't play the games, and we're halfway through the season, and I wanted to play. So they said, come see our chiropractor. So I went to see the chiropractor, skeptical at first and everything, and he looked it over. He says, okay, here's what's going on. You've got a shift in your pelvis, your back is turned this way, all these different things. Okay. So he ended up fixing me up because I thought my season was over. And he ended up helping my back out. I was able to then play the rest of the season, and it impressed me so much that I started looking into it more. And I was very intrigued by the philosophy of chiropractic,
Sure.
where it was a natural approach to health. It wasn't something where you're relying on drugs or medication or surgery or things like that. It was all natural. You're just basically helping the body heal up faster by providing the chiropractic care. So I decided right then and there I wanted to be a chiropractor. And so this was when I was a junior in high school, so I already knew what I was going to do. And so about a few months after I decided, my older brother, Ron, who was an athlete as well, and he was going to be a Phi Ed teacher was his goal, he said, I think I want to do that too. So we ended up both graduating and going to chiropractic college and getting our degrees, and we opened up practice together. And so that was back in 1983, and so that shows how old I am. But so we practiced for many, many years together, and he's recently retired. But so I've enjoyed being involved in chiropractic, and it's given me many different opportunities, especially some of the certifications. I have some extra training in sports medicine and in athletics, and so I became certified as a personal trainer. And so I found all these things that I thought could help my patients. And so I was competing in bodybuilding and everything. And so all these things of working with the body, it was a natural fit for me to also work with athletics and be personal training, so I could put people on routines and everything. So I just got very, very involved in that. And I was fortunate enough to be able to work at the Olympics and work at some world championship events around the world and everything as a chiropractor. So it's just been a great journey for me at this point, and I just love what I do, and I want to keep doing it as long as I physically can.
And you're really good at what you do.
Well,
And I can
thank you.
say that from experience, everybody. Now, Dr. Terry, you heard that. We are going to talk about the Olympics and bodybuilding and so many other things. We're going to touch on all of that. But we're going to start with some chiropractic tips.
Oh, sure.
Because you have some tips for us. And believe me, if he gives you these tips, you need to use them because I use them. Whatever he says to do, just do it because it's going to help you. So go ahead and share your tips that you have with
Sure.
us
Yeah.
today.
Well, as most people know, especially if they've been to a chiropractor before, they know that we concentrate on the spine. That's one of our main areas, but we also will work on shoulders, knees, hips, ankles, things like that. Well, one of the things that we are seeing now that I never used to see as much before, Pamela, was with everyone now using computers, everyone's on computers, and now the use of smartphones in there, I'm seeing more and more neck problems. And specifically now they've even got a term for it, maybe you've heard of this before, tech neck or text neck. And so what's happening is now, first off, we'll talk about the computers. Everyone's at a computer, most people now working at their office. And this is even more important now because with the pandemic that we've had, people are working from home. So many of them don't have those really good workstations that they had at their office.
Right.
So now they're at a kitchen table, they're using a laptop, their seat is the wrong height, they're either hunched too forward or whatever. So basically what we're talking about with these problems with the neck and this tech neck is people now are hunched over these laptops, over these keyboards, and they're getting into this position now where they're just hunched over like that. It's bringing the shoulders forward and it's bringing our necks forward. So now we've got all this stress. Our shoulders aren't meant to be pulling forward and our neck isn't meant to be in that position like that too. So what do we see people now doing on their phones? And unfortunately, I see this in a lot of young kids. They're all day, they're on their smartphones, they're doing this kind of thing. And so we're getting with these kids now, these teenagers are getting this forward poking or tech neck of the head where it's pulling forward like that. So now we're seeing so many more neck injuries, neck problems, tightness in the back. And so after a while, your shoulders are being pulled forward, your neck's being pulled forward. Our muscles go, wait a second, I gotta hold back. And so those start pulling. Well, that just creates more tightness then in the muscles. So it's this constant battle. All of our weight's going forward. Your muscles are saying, no, we're not supposed to do that. So your back of your upper back, that's why people are so tight in their upper and middle back. Let's pull those shoulders back. So it's this constant battle. And so now what's happening is we're getting those heads forward like that, and it's creating all kinds of neck problems, headaches. We're seeing people getting pain that's going down the arm and all those kind of things too. So one of the tips that I wanted to get at was things that people can do, whether they're over a computer all day, whether they just are on their phone all day, is obviously first and foremost, we want to really try to keep our posture upright as much as possible. So when they're at a workstation, try to make sure your chair height and the height of your computer and everything is reasonable. We don't want something that's too low. You do this. We don't want something that's too high because then we're up like this. I mean, both can create problems that way. So what we want to do is make sure that everything is level and we can adjust ourselves and make sure that we're in the right position like that too. So once we get that down, we're not hunched over, we're doing that. We've got a good workstation too. One of the stretches and exercises and things that I like to do is what I call a neck retraction exercise. Because again, we're getting this forward head poking with all of our use of our computers and smartphones. So what we want to do is basically you're sitting up straight. Think about just gently tucking the chin down a little bit. That's our first position. So it's just tucked down a little bit. And I like to use my fingers as an assist to do this. We're going to just straight retract the head back. We don't want to arch the head back. That's not what I'm talking about. So the fingers will help me get this movement down. And once you do that, then you don't necessarily need to use your fingers, but we're going to push the head back in that position. So if you can picture you're pushing that head back, almost like you're giving yourself a double chin, but think of it going straight back. Again, I'm not arching, but I'm just using those muscles that are so tight and they're actually weakened because they're not being able to hold you back. So you're just jutting the chin back and then you hold that for say a count of 5 seconds or 10 seconds or so, and you'll feel a lot of strain up in there.
Yeah, I do. I feel it.
Yeah, because we're not used to that. So those muscles are going, wait a second, I haven't been used like that for so long. So they're going to be a little tender, maybe a little bit stiff and weak when you do that, but they're going to get stronger and they're going to help control that. So again, it's just jutting the chin back. We're not arching the head, just jutting the chin back, holding it like that too. And as you get better with that, you could actually then proceed. Yeah. And you may feel like in the beginning, you just can go back a little bit, but pretty soon you notice that, oh, now I'm going back maybe a few more inches like that. And that's where the fingers can help get you train your neck into doing that. And you could actually take some of those little stretchy bands, put it behind your head, and then just push back. So you got the stretchy bands pulling you
You
forward.
guys are all doing this, right?
Yeah, and so your head is pushing back. Now we're really strengthening those up, and it makes a huge difference. People's posture is better. They notice less headaches, less tension in the neck. Again, you can pinch nerves when our neck is being forward, so you don't get that arm pain anymore. So that's one of the tips that I say. Just that simple exercise alone, along with just watching that your workstation is held up in the right position. Yeah, exactly. Yeah. And so now I have some of the kids will actually then hold their smartphones up, maybe prop something up so they're looking more straight ahead
Sure.
and not having to tuck down like that too. So like I say, it's something we've seen now more recently just with the advent of all the technology that we have. And it's good in that way, but it's not good in the way that people's
Of what,
postures
yeah.
are
How
doing
many
it.
times a day and how many repetitions of doing
Yeah.
this?
So what I like to have them do is do that at least 10 times. So hold it back like that. And again, it might feel uncomfortable, but hold it back 5 seconds, 10 seconds. If you want to go longer, you certainly can do that. But it's going to be, if you can do that 10 repetitions or so, and you can always do it 2 or 3 times in a day. But it's very good to take that break when you know you have to be on your computer for a while and take that break. That's a great time. Let the arms relax and then do your neck retraction exercises. So it's really, really good to do that on a regular basis. And you will notice that you'll start to get less stress and strain in that neck. And you're going to have probably, like I say, less headaches and problems with your neck because of that.
It's so simple.
Yeah, exactly, too. A quick tip also, now that was talking about the neck, but now we're going to talk about something with the lower back. And this time of year, where people are starting to rake leaves, or we're going to be into a snow shoveling season. I hate to say that soon before we know it, but also one of the things that we want to do is change our posture when we're doing some of these things. So when we talk about, I have a lot of patients that are golfers, and now we're getting into the autumn, so there won't be a whole lot left in the golf season. But I want to give a tip to those golfers that are out there. Actually, I don't know if you know, Minnesota is one of the highest rates of active golfers, even though we only golf so many times a year because of the weather. We actually have the highest population of active golfers of any state in US. Yeah, yeah. And I have a lot of patients that are golfers, and of course, a lot of them come in with back pain. So here's the tip that I give for golfers, and we'll relate this to raking leaves, snow shoveling. But first, with golfers, is it okay if I stand up a little bit and shoot that like that? Yeah. So here's the thing that I tell them. So if you think about, let's just say the most golfers maybe are right-handed golfers. So what they're doing is they're typically swinging from right to left. Right to left. That's the big swing. They do bring it back, but all their momentum is really going from my right to my left side like that. So we're getting this constant twist that's going on in the back. So what I tell them to do, and because a lot of them will end up having back pain because they're going, oh man, I'm just, think about it, an 18-hole round, as well as they've gone to the driving range, they've been hitting a ton of balls. So they're constantly doing the same movement from right to left, right to left. So what I tell them to do is when they're on the golf course, maybe every third hole, have your buddies tee off in front of you, grab one of your light irons out of your bag, maybe like 9-iron or so. Now what I want you to do is grab it left-handed and swing the opposite direction. Start doing that and maybe about 10, 15 swings or so like that. Now we're starting to train the body and the back going in a different direction. All round long, you're going one direction, stressing it this way. So I'll just have them use a light iron and just start going back like this. Just start doing it. It'll feel a little awkward because they're not used to swinging left-handed if they're a right-handed golfer, and start doing that. And that really helps to start to maybe remove some of the pain, kind of get your back used to training in a different kind of a manner. So I found that very effective for my golf patients who are doing that. So now we take it from golf and we think about, now we're into the fall season. Some people have to rake leaves and everything. The same thing applies with raking leaves. I got into the pattern, if I was raking leaves, I just was natural. It just would always be, my right hand would be up here and I'd be raking leaves like this. Well, what I tell people to do now is, that's the way you're doing it, switch it around. Now go the other direction. So it's the same thing as doing like with the golf swing. We're changing directions now. We're going from different directions. So every once in a while, just change directions and go back to doing this way as well. So then we get into snow shoveling. The same thing as too. I was fortunate. I had the opportunity. KSTP had called me years ago. They said, we understand, you've done some video of, proper lifting techniques, and they had heard about me. So they had me come into a segment on snow shoveling. And that was very, very interesting and fun to do, because I went over those same things where, again, we get caught into, if you have a snowblower, that's great. But obviously there's times when some people don't have that and they're going to have to manually shovel. So we do the same thing. We do this. We're going over and over like that. And all of a sudden we're wondering why our back's killing us like that too. So same rule applies. Every so often, after every few shovelfuls, go to the left side. Again, it's going to feel very awkward to do that. But again, we're just trying to balance out our body and our spine so that we can avoid possibly getting an injury. So all those things, from the technique and going, trying to change the positions there, to now we're using, raking leaves, shoveling snow, all those things. We're just trying to avoid injury and balance out the muscles in the body to keep them from hopefully having an injury.
Those are great tips. I hope you wrote all those down, and maybe you're even up practicing them with Dr. Terry. All right. Thank you for those tips.
You're
Those were
welcome.
great. Next section that we are going to discuss with Dr. Terry Drassal is a program that is named or called Chirothin. Now, chiropractors are the ones that can assign or can give you permission and work with you to take and be a part of the Chirothin program. Is that correct?
That's correct.
So there are lots of ways to get your body healthy, lose weight. Has anybody ever been on the roller coaster ride? Has anybody here ever had a hard time losing weight? So, and it seems like there's certain times in our life where our chemicals and things just kind of change or stalemate. Sometimes even as we're getting a little bit climbing up that ladder of age, there can be adjustments and changes. Well, I went through that and had a hard time getting the scale to go past where I wanted it to, no matter how much I ran or what I didn't eat, or how I starved myself, or get rid of all carbs, or whatever the case may be. And Dr. Terry, as I said, is a good friend of mine, and also my doctor as well. I don't just call him Doctor of Chiropractic, but he is really well in his health and wellness doctor. I mean, he has done so much for me. So when he said, "Hey, have you ever thought about Chirothin?" I could trust him because he's an expert. And he's not going to tell me to try something or do something that would not be good and healthy for me, or that he would not check and actually do kind of a checklist with me and say, am I a good candidate for this program? Now, I will tell you that my confession of faith, and you guys know how I feel about what we talk about, what we say about, we bring about. So it's all about that mindset, right? And so I believed that I was going to lose that 25 pounds or whatever it was, that I was going to get into that best health condition that I had been in my life. And I continued to confess that. Thank God for that. And believe that what I'm looking for was looking for me. And about that time in my life, Dr. Terry all of a sudden started, can I hold one of these up?
Yes.
Started with this program called Chirothin. And I trust him, and he's going to tell you why you can trust him too. But let me tell you, I am a living example, and I'll let him share all of that. But my life has changed because I'm close to 15 years younger. He'll tell you what that means, than I was when I started, and over 20 pounds lighter. And it has absolutely changed my life because I feel healthier all day long, and I'm able to just enjoy my life better and carry the mantle upon my shoulders of what I'm supposed to be here to do. So with no further ado on that, Dr. Terry, share with us about Chirothin, because I'm a testimonial of it. I'm sitting here right next to you saying, this is why I wanted you on the program, was I want you to tell people, because so many people out there are struggling just like I was. But also, why can we trust you? I know why I can trust you, and I believe that people trust me enough to say, hey, if Pamela says you can trust Dr. Terry, you will. But I want them to hear from you why you're the expert.
Sure.
So would you share that with us today, please?
Yeah. And congratulations, by the way, Pamela, and your success with Chirothin too.
It's been awesome.
Yes, and that's what we've been finding with all the people that we put it on, clients as well as patients that I actively have too as well. So just a little background in some of that, but this is maybe something that you didn't realize, but 95% of the people that try to lose weight and go on a diet or anything, 95% of those people fail. They
Yeah,
don't succeed. It's a huge number, and it's something that nowadays people are looking for some kind of a program, some kind of a system, and some people will try certain systems, things like that. And Gallup did a poll recently, and the poll was to determine people if they want to lose weight or whatever, and over 50% of the population wanted to lose weight. They knew they needed to drop weight, and so over 50% realized that. 29% of the people were actively trying to do something about it, whether it was on their own or through a program or whatever it was, and it wasn't always successful or anything, but at least a third of the people were trying to do something like that. So it's a very, very popular topic when we're talking about losing weight. Most people want to do that, and it's estimated, like I say, that 95% of the people try some kind of a diet and they fail on it. So when I had heard about this program, I was looking for different kind of weight reduction programs, weight loss programs, and there's so many of them that are out there right now. And what brought me into that was, if we flash back to last year, the pandemic happened, the pandemic occurred, and so at that time some of the gyms were closed. We couldn't go and work out, and so I'm always at the gym and working out and everything. And again, my background is I've done bodybuilding shows, so I've learned about nutrition, on how to diet to lose weight, because I had to be on stage with very little body fat and enough
sure.
muscle and everything.
Yeah.
So always had an interest in nutrition, and I have extra certification in sports nutrition, things like that. So I've always employed diet and exercise with my patients, as I've gone through my chiropractic career. But I found myself, when this pandemic occurred and the gyms were closed, that I couldn't work out at the gym anymore. And so I found that I had actually put on a little bit of weight. Even though I know better, I could probably do things, body weight exercises, but I was guilty like everyone else. I get busy and everything. And so I ended up not working out, and so I put a little bit of weight on. So I was searching and looking for some programs that I would like to try out for weight loss. And in my searches, I came across this program called ChiroThin. And I thought, well, that's interesting because it's only offered in chiropractors' offices. It was specific for that. And I wanted to find out a little bit more about it. And so as I read into it, it sounded very interesting. It was a doctor supervised program, so the client or the patient would actually have doctor supervision. In this case, it would be me that would be meeting with them on a weekly basis. So it was doctor supervised, which most of the other programs, from my recollection, aren't. The Jenny Craig and Weight
Right.
Watchers and those kind of things. Whereas this one, so I thought, well, that was pretty impressive to do that. And so I wanted to look into it a little bit more. And basically, what I learned about it too is that it's not only doctor supervised, but it basically was a program that helps to burn fat. It helps to reduce your appetite, suppress your hunger. It helps to stabilize your hormones. It really is something that helps to actually stabilize blood sugar levels and your hormonal levels. And the hormones are so huge with affecting our body chemistry as far
Yeah.
as weight gain, weight
Yeah.
loss, things like that. So that impressed me. I think, well, there's got to be some science behind this that backs this up too. So I thought, you know what? Anytime that there is some kind of a program, whether it's a nutritional supplement or a program, I want to be the guinea pig for it, because if I'm going to want to have my patients or friends of mine try a particular nutrition program or something, I want to know that it's good. And
Right.
I want to
Right.
know that it works. And so I thought, I'm going to do this program since I wanted to drop a little bit of weight myself. I want to find out, is it effective? Is it hard to do? Am I going to be craving food all the time? My stomach's going to be growling? And so I think in all these things that could possibly happen. So I thought, I'm going to test it out. So I talked to my office manager at the time, and she said, I think I want to try this out too. She had put some weight on, and she says, I want to drop some weight as well. Can I try it with you? And I said, absolutely. You'll be I want to get your feedback as well. See what you notice. We'll see what I notice, compare notes, so to speak, and see if this is something that
You had a man and a woman doing it then.
exactly right. Yeah. And so I looked into it and I got the program. And basically, to start with, what I'll tell you what it was it basically is a program that's, like I say, it's doctor supervised, but it really works to balance our hormone levels, balance the blood sugar, which again, blood sugar is so crucial with weight gain, weight loss, things like that too. And it really involved two main key components. One is the Chirothin eating program. And so what the program is it's a program that really uses real foods. It's whole foods.
Yes.
What I didn't want to get into was something where you had to buy their prepackaged meals or make up shakes, which taste horrible most of the time too. And so what people do when they're on those things, when they go off of it, maybe they do lose a little bit of weight when they're on some of these things. It takes a lot longer than on the Chirothin, but let's just say they do lose some weight. What do when they stop? They're used to having prepackaged foods and now they don't know how to eat properly too. This program uses real foods. You go to the grocery store and it's foods that are right in front of you. So when they go through the program, and it's a 6-week program, so it's 42 days, when they go through the program and then they go on what we call a maintenance phase, they can just go to the grocery store and keep eating it. They
Yes.
don't need to order some more prepackaged meals or shakes and all those kind of things too. So I like that about it. And so the foods that it was concentrating on was really two different things. Low glycemic foods, which are low sugar foods,
Mhm.
and anti-inflammatory foods. We're really finding now that when our bodies gain excess fat, it's very, very hard on our bodies, first off. But when we gain excess fat, it increases body inflammation. And so,
Yes.
and now we're hearing so much about inflammation in the body, like systemic inflammation. I'm not talking about localized, if you bruise yourself, you swell. I'm talking about systemic inflammation throughout our whole bodies. We're really finding that has a huge factor in many of the diseases that we're talking about. We're talking about heart disease, we're talking about diabetes, we're talking about cancer. Some forms of cancer can be accelerated when our weight is up. And so we're finding about how all these things will help to reduce body inflammation. So that's why these foods are anti-inflammatory foods. So that's why we're getting into how it can affect the hormones and the blood sugar levels too. So it's a combination of these low glycemic, low sugar foods, anti-inflammatory foods, along with specific some behavioral changes. And one of the keys is, yes, exactly, is the Chirothin formulation. So this is a liquid formulation, and you take these drops. So people have asked me, they'll say, well, it's a very low calorie diet during this 6-week phase. They'll say, I've tried a low calorie. I tried to starve myself and everything, and it didn't work. It was after I could hang in there for a week, maybe 2 weeks, and then I was totally ravenous. I was so hungry, I couldn't stand it, and then I just chowed down, and then I gained, any of the weight back too. What's going to be so different about this? It's true, it is a very low calorie diet in there, but this is one of the keys. Those people that were doing that, for one, probably weren't eating the right kinds of foods and types of foods, the anti-inflammatory foods and the low glycemic index foods, and they weren't using them in the right combination, which is a real key too. And so that's what this program does. It has specific combinations of ones that are allowed, ones that you don't want to really use, and by using those, but this is the key. So a diet that's very low in calories without any nutritional support is destined to fail. But a diet like this, the Chirothin diet, because of this formulation, is phenomenal. And what it is this program here with the dietary formulation. It's composed of different amino acids. It's got vitamins, minerals. It's got some B vitamins in there as well, and some cell salts. But basically what it does, it's all these combinations of the things that are in there. They help to, one, suppress the appetite. They help the body speed up that fat burning process. It helps to keep our appetite down. and it keeps your energy levels up while you're losing the weight. And so that's the key. Other programs that just go on a low calorie diet fail all the time because they hang in there for a couple weeks and then they just can't continue to do that. And it makes sense. This one, we use the right combinations of foods. You're eating your fruits, you're eating your vegetables, you're having your protein, you're having some bread, but it's certain ones and it's in certain combinations. And the key again, you're using the nutritional formulation, the ChiroThin formula, which then keeps the cravings down and it keeps the body fat burning and it gets that whole process going. So that's what I was impressed with. So again, now it goes back. So now I'm trying this now, and my office manager is trying this as well. And so we went through the program, and again, it's a 6-week program, 42 days. And my goal basically was because I really wasn't needing to lose that much weight. But again, I knew I had gained a little bit with the gyms closing and my eating wasn't as good as it should have been. So my goal was to maybe lose 15 pounds or whatever, that kind of thing. Well, I ended up losing almost 30 pounds on it. And I got my body fat level got down to a point where that was when I was competing in bodybuilding contests way back. It was that low and I got to that point. And my office manager, she had lost like 20 pounds. And so the question is, in the 6-week program, what do people do? Here's what the averages show for this program. In the 6 weeks, men will lose anywhere from 30 to 40 pounds. And in the 6 weeks, women are generally losing anywhere from 20 to 30 pounds when they're on this too. And so that was Jennifer's experience, and she had lost about 20 pounds. And she really was happy for that too. And so that's what kind of got me started, and I was very impressed with it. So I decided to get involved in the program and be one of the doctors. You have to qualify and join into that network. And so I decided I wanted to do this, to be able to offer this to my patients, to my family, to my friends, things like that, and just let them know that there is an alternative out there to some of the programs that are out there, or just trying to makeshift some kind of a weight loss program on your own. And the interesting thing about this one, during the 42 days, you don't exercise. So people always love to hear that too. They say, great, I don't have to work out and everything.
Right.
No, there will be a time when you go in the maintenance phase where you do want to be involved in some kind of activity and exercise if you can, but there's no prepackaged meals. There's no crummy tasting shakes.
Right.
There's no other things like that. It's like I say, it's real food and you're taking the drops. And as long as you're following the program, and we recommend they have a lot of water, they're drinking water, all that kind of thing too, it works.
It does.
Yeah, it works and you don't feel it. So I was expecting, as I was going through this, again, I was expecting that my stomach would be growling and that kind of thing, and I'd be famished. And I didn't have any of that. And I was surprised. So basically, it's a 2-part thing. You're having lunch and dinner. So you are skipping breakfast during this, but you're still taking these drops 3 times a day. And I thought, normally I'm a breakfast, lunch, and dinner person prior to this one. So I thought for sure that I would be having all these, my stomach would be rumbling and everything, and I'd be dying. I can't wait for lunch to happen. And there were so many times that I thought, oh my gosh, it's 12:30. That's right, I'm supposed to eat, aren't I? That kind of thing. And that happened so many times because I wasn't feeling hungry. And that's, again, part of the nutritional formulation. It suppresses that hunger crave and our appetite while it's helping to burn fat and everything. So I was very impressed with it. And so that's why I started to offer it now to clients and to patients that come in here. And I really haven't advertised for it. It's just been word of mouth. People have looked at and talked to my office manager, and she wouldn't mind me saying this, but they'll tell her, Jennifer, you've lost weight. And she says, well, actually, I have. And so what she's done then is she went through the maintenance phase, and then she kind of went through the program again and everything. So again, it's phenomenal for those people that want to lose, 20 to 30 to 40 pounds, that kind of thing too. But there are some people that maybe want to lose a little bit more. And that was my office manager's case. And so she actually then went through the program again and followed it through. She's gone from a size, and she wouldn't mind me saying this, a size 14 is what she was at. Now she's wearing a size 2.
Oh my goodness.
So that was a phenomenal. So
Oh my
she's one of the
goodness.
best testimonials that I can
Yeah.
have. And again, it's just been word of mouth. We really haven't put this out, and I need to put it on my website and things like that, or just advertise it more, because this is something that can help people. This is something that
Yes.
is creating 80% of our health conditions can be totally related to being either overweight or obese. And again, we've talked about it, heart disease, high blood pressure, cancer, high cholesterol, diabetes, all these things that are costing millions of dollars in
Right.
healthcare,
Right.
and people are taking all kinds of medications for it too. We can maybe help them with some of that. Maybe the diabetic can maybe get off his medicine or at least maybe reduce it a little bit. And as he's dropping body weight, maybe that person that is on a lot of blood pressure medications can go off or at least maybe drop it down a little bit, because we all know that there's going to be side effects with all these
Yeah.
medications that people are taking. So any way that we can help somebody's health and help bring their cholesterol down, their blood pressure down, their weight down. So all these things, when we lose body fat, it is so healthy on the body. So many things get better. My office manager was remarking that with the weight loss, she wasn't having that knee pain that she had for so many years. She said, I can't believe it. My knees are feeling better. And it makes sense. You know, when our body weight is down, we have less stress on our joints, on our
True.
hips, our knees, our feet, and everything.
Yeah.
So a lot of those conditions will improve in doing that. So it's just excited me about it because it was real food. It was not hard to do. I didn't feel like I was hungry at all. And I dropped the weight. You take the drops, you eat the food, you follow the recommendations, and drink the water, and you drop the weight. And so I
Yes.
just was really, really impressed with the program. So I'm now trying to encourage people and tell people about it a little bit more so they can get healthy and feel good. And
Absolutely.
yeah. And it really helps to keep you and because people say, well, once you stop the 6 weeks, aren't you going to gain all the way back? No, you don't, because it's a lifestyle. This program is designed to keep it a long-term plan. There's so many plans out there where you could drop immediately. You could probably drop 20 pounds if you starved yourself or something like that. But within the next few weeks, you're bringing it right back again too. So this has long-term maintenance built into it, and you have different relationships with food, and you learn how to
Yes.
eat correctly too.
Absolutely.
Yeah, so you learn how to eat properly, and doesn't mean that once you're just maintaining your weight, doesn't mean that we can't have our treats. I'm
Right.
not saying you can never have your piece of cake or pie. No, but you do that, and then you just realize that, hey, that was nice to eat too, but it didn't disrupt your plan. You're still following that plan. So you can allow yourself to have these little indulgences and that kind of thing. But it's interesting, what I find is that when people do that, they've been eating so good, they feel so good, their blood sugar is down, their hormone levels are balanced, they've got more energy, they're fitting into clothes better, whatever it may be. And maybe they just junk out a little bit. I haven't had that, and they junk out like that. They feel horrible. Their
Right.
body isn't
Yes.
used to that. All of a sudden, we flood it with a bunch of processed sugar and things like that, and they just say, "Wow, that wasn't as good as I thought it was going to be, too."
Yes.
And it's a motivator. It's like, you know what? That's why you feel good. And so again, you don't have to totally be away from that stuff, but I think you'll agree that when you
Yes.
have that, you just feel lousy. And
Yeah.
so it just really is a wonderful way to improve your health, help some of chronic medical conditions that many of us have, and enjoy a healthier life.
I love it. And that is exactly what has happened to me. So, Dr. Terry, thank you so much for sharing about Chirothin.
Yeah,
Tell our audience how they reach out to you
sure.
so that they can contact you and
Yeah.
learn more about it.
Yeah. So that's great point. So what I tell people is if they want to come and find out more about it, we do a no cost, no obligation consultation. You can just come and meet with me for maybe 15, 20 minutes or so. Actually, what I found, Pamela, is that probably 95% of the people have the same exact questions. When I
Yeah.
talk to people, it's almost like the same exact questions about this program. So what I like to do is if you come in for this free consultation, I have a short video that they can watch. It's maybe,
Yeah.
8, 9, 10
Yep.
minutes long, and it explains over and answers most of the questions that most people have. And then I'll let them watch that. I'll come back in the room and I'll pretty much say, is there any other questions you have? And if they do, then we address those and we talk a little bit more about it. But that's what I like to have them do. Come in, there's no obligation. We're not going to be a hard sell or anything like that, but they can ask questions about it if they weren't answered on the video, and we can talk to them about it and see if they're a candidate for doing that kind of a program. But like I say, I was thinking when I first got into this program, it might be people that had, maybe like 70, 80 pounds, that kind of thing to lose. Actually, that's not what we got. We have people that wanted to lose 20, 30 pounds, maybe 40, something like that. And for that population, it works phenomenal
Sure.
like that. And so that's what they can do. They can call us up and you'll give them probably the
Yep.
phone number, that kind of thing, all that
Yeah, it's
info.
all in the description, website and phone number, so you'll be able to reach out to Dr. Terry.
Yeah. And so we can come in, we can talk about it. If you have questions, we'll do that. And if you decide that you want to do it, fantastic. I think it'll help change your life and you'll just be a happier and healthier person as a result of that.
All the way around.
Exactly.
Woohoo! All right, we're still here. Are you guys, is this awesome or what? Are you learning a ton today? You better be, because have learned so much from this man, and I'm learning so much today. Like, there have been new things that you've said, and I've gone, wow, I didn't realize that. Like, that's amazing. Like 95% of the people trying to lose weight, it doesn't work.
Right.
That's a huge number of people trying to get healthy
Yes.
and feeling unsuccessful at it.
Correct.
Chiropractic care is a big deal when it comes to health and nutrition. And I have learned that over the years by having you and your brother as my doctor.
Right.
I've learned so much about how chiropractic care with a good chiropractor, especially somebody like Dr. Terry, who's got all this other wealth of knowledge in so many ways that can help you. I would, he's not allowed ever to retire. He's not ever allowed to leave. He can't, because I need him, and so do so many others, including you. So I have learned that this is so imperative to our life, that to help us continue to be healthy and grow and be strong. There is so much intricacies with chiropractic care, as I said, especially if you have someone that has some knowledge about health and wellness. So I'd like to take a few minutes, Dr. Terry, and let you communicate to the audience
Sure.
why chiropractic care matters,
Mhm.
and what about, you've already said what sets you apart, with all the other knowledge and things that you've had. And we're going to talk about the Olympics, so stay tuned. We're going to talk about bodybuilding, so stay with us. But can you just kind of summarize the importance of chiropractic care and how that affects our health in general?
Yeah, exactly. It was interesting. A number of years ago, Dr. Sperry won the Nobel Prize for brain health and brain function. And what his determination is that he said that 90% of the stimulation and nutrition that go up into our brain actually is a result of movement of your spinal column and the nervous system, like that. That's huge.
Yeah.
How it affects our brain. And when he used the word movement and the nervous system, that totally talks about almost chiropractic, because what we do as a chiropractor is we are assessing movement in specifically the spinal joints, but also I'm assessing movement of the shoulder if a person has shoulder problems or knee problems or hip or ankle, things like that. But basically, if we're talking about the spine, which houses your spinal cord and all those nerves and affects the nervous system. So we're talking about movement and how crucial that is. So as a chiropractor, what we do is patients come in, and let's say they come in if it's lower back pain or whatever. So we're going to assess their condition. So it's interesting because I may do things a little bit differently, but let's say Pamela is a new patient. She comes in, she's complaining of lower back pain that she's had, and she wants to get that figured out and worked on and get better. So you'd be probably interested to know that I wouldn't immediately look at your lower back. What I would first have you do, Pamela, is I would have you stand in front of me. I would have you out of your shoes, because we need you to be like in socks or in bare feet. And I would assess just looking at your posture. Do you have one hip that's high or whatever? But here's one of the interesting things that I'm seeing on probably maybe even up to close to 50% of some of the people that, especially if they're complaining about lower back pain too, I'm looking at your arches of your feet. I want to see, so if my fingers are facing you, this is like me facing you, here's my toes. What I'm talking about is our arches will tend to collapse on some people. We call that overpronation. So imagine here's my arches and they overpronate like that. I have that happen to me, so I know what it's like. And so that's what I'm looking from the ground up basically. You came in
Sure.
for lower back pain, but I'm going to first start, I'm going to look at your alignment and structure as we're going up that chain. So
Sure.
let's say I see that and I look at that. The next thing I might say is, can I just see your shoes? And I'll check the back of your shoes to see if there's a wear pattern, especially if it's shoes that are, say, maybe 6 months old or older than that. I'll look at the shoes, whether it's a tennis shoe, a dress shoe, whatever, and oftentimes I may see a wear pattern on that heel, which indicates that there is some distortion, some tipping that's going on in there. Well, here's the significance. You go, well, why are you looking at my feet? My back is the problem, that kind of thing too. Well, if you're able to do this with the camera to show it here too, if I can stand up. So here's what happens. So I don't know if you can get down to the my hand there like that. You able to do that? Okay. So again, overpronation, imagine I'm facing you. That's when those arches will collapse and they turn inward. Some people actually go totally flat. Some people like me don't go totally flat, but they end up still going in a little bit. So here's the interesting thing and why it can affect people's backs and hips and knees. So I'm going to put my finger down along my shin. Now I'm going to make my foot collapse in or overpronate, we call it. Now I do have a nice insert in my shoe, so it's a little harder for me to do that, but you'll still get the idea. Watch what my finger does. I'm going to make my foot overpronate, which I said is probably almost 50% of the population have this. So watch what happens. So I'm
Oh,
collapsing my
wow.
arch. Can you see how that rotates like that? So that's the effect. So when it's unsupported, it will rotate in your lower leg. That in turn, now we go up
Your
to
knee.
the upper leg. Now my femur,
Yep.
upper
Yep.
leg rotates inward. That in turn causes my hip to be rotating. That in turn causes my lower back. So it's this whole chain effect that we've
Wow.
had. It works its way up. So that's where someone has a problem with that can give them ankle pain, knee pain. We're talking plantar fasciitis, maybe shin splints, knee pain, hip pain, and everything. So we want to address that. We want to make sure we're checking that out as well as your lower back. But
Right.
what I'm saying is so many times there's other things that are contributing to the problem.
True.
We talked about the neck and how, if someone comes in with neck pain, well, tell me about your workstation. Tell me what that. And we find out, yeah, they're hunched over. And so now we know that there's some things that they need to do. So one is we're determining where the problem is it's coming from somewhere else contributing to that. And once we maybe start to correct that, we can talk to the patient about maybe putting some inserts in the shoes to correct some of that. And then that keeps everything straight while we're working on the lower back and in this case as well too. And so what I try to do when a patient comes in is, like I say, I'm assessing the whole body, but also my main goal is get this patient out of pain as quick as possible. That's my first and foremost thing. We want to get that pain reduced as quick as possible. Secondly, then we want to work on getting the alignment, getting things moving. And that brings me back to what that Nobel Prize winners talked about movement
Yeah.
and how the spine was so essential for brain health and everything. That's what we specialize. That's what chiropractors are looking for. So when we analyze the spine, here I've got this is the lumbar spine. We're analyzing, as in your case, let's say you came in with lower back pain, I'm going to check for movement. So I'm going to have you maybe do some different movements, things like that. And when you're then on the table, then I'm going to check, is those spinal joints moving? So as a chiropractor, we are working and checking the spine, and we're finding those areas where, for lack of a better word, stuck. Those joints that just aren't moving as well as they should be. Those are the problematic areas. And so we talk about spinal alignment, and yeah, that's part of it. There will be some shifting, everything, but we really want to talk about the movement. What isn't moving when it should be moving? And think about it. We've got over 120 muscles that go into our spinal column like that. We got these superficial, intermediate, and we have deep muscles. So we have all these muscles that are connecting into that spinal column. So what happens is once we don't get that movement, when those spinal joints are locked up, they're stuck, they're just not moving.
Yeah.
Those muscles that connect into that area have to work that much harder because they're going, okay, this joint is not moving, so let's tighten up, let's pull it, let's try to get it moving. Well, they overdo it and they get tight. So now we have this building process where it started out as a spinal problem. Now the muscles get involved, so they get tight, so they become part of the problems too. So we're assessing that movement. We're assessing the muscle tightness, so we'll work on the muscles as well, do some therapy on that, some muscle work, trigger point therapy. But then we're getting in on those spinal joints, and that's where the chiropractic adjustment goes. You heard of people talking about an adjustment, but basically what it is we're getting a very precise, localized point where we make a contact, and then with the adjustment, it is a little bit of a thrust, and we get some movement back into that spine. Sometimes people hear the click or the pop or things like that, but the goal is we want to restore that normal motion in that joint, because that's what's causing the problem. And sometimes if it gets going long enough, it will start to then pinch the nerve. So as you can see from here on the spine there, we've got here's your vertebrae, there's the disc. That's our like our little cushions between the vertebrae there, and then the other vertebrae there too. And so what we're talking about now is this is the back of your body here. So those spinal joints that are normally supposed to, they can bend forward, they go backwards, they can go rotate side to side and tilt back and forth. They get locked, they get stuck. And so our job is, let's get those unstuck, let's get those joints moving. So that's where the chiropractic care comes in handy, and we start to then restore that natural motion that should be in there, and the patient gets relief, they get pressure off the back, and they get pressure off of nerves if the nerves are being irritated. And so that's part of the process. And so first, get them out of pain as quick as possible. Secondly, then start working on aligning things up, getting the spine moving, getting the joints moving, getting that better, working on the muscles that are sore and tight and things like that. Then what I try to do is when they're ready, I get them on an exercise routine. So we get them out of pain, correct the spine, get those things taken care of. Then I want to show them what they can do on their own to keep themselves healthy. So I want to have it to where I try to get my patients as good as they can, show them what they can do, and then if they need to come in for tune-ups, I'd love to be able to do something like that rather than have somebody have to come in and need a number of treatments. Sure. This will help keep them feeling better for longer. They may not need quite as much chiropractic care. And so if they've got a membership, say, to a gym, and with my background in weight training and bodybuilding, everything, I can tell them exactly what to do at the gym. Oh, you've got access to this machine or that machine. Here's what I want you to do. Oh, by the way, don't do that. And I've had the experience with personal trainers, because some of these people will hire personal trainers. This is my own opinion for what that's worth, but I've seen too many trainers as I'm in my gym doing my workout, watching them do that. And I hate to say it, it seems like everyone is put on the same routine, whether they're 15 years old or they're 70 years old. Everyone gets the same routine and everything, and that can't be that. Everyone's different. You all need different things. And so I like to use my expertise in telling them, okay, here's what's going on. So I've got that advantage of not only being a chiropractor, but also being a bodybuilder and working out in the gym. So I think I have that little bit of extra advantage in showing them what to do correctly and how to prevent this maybe from coming on. Whereas maybe that personal trainer isn't as knowledgeable in anatomy and physiology as maybe I would be like that too, and has the experience that I have. So that's where I feel like my experience in that can really help them in getting their body stronger, getting it more flexible. If they don't have access to a gym, I'll show them things that they can do. Maybe they have exercise equipment at home. Maybe they've got some dumbbells, some hand weights or some things like that. I can show them a routine with that. Or if they have nothing else at all, I can show them things that they can do with body weight exercises or stretches or things like that can help to heal their body back up and everything. So I just feel like the additional knowledge and training that I've had has been a benefit to my patients, because I can show them what to do and what not to do. Because again, there are so many machines and exercises out there that seem like they would be good, but maybe not for that particular person. Someone's got a shoulder problem. I'm going to tell them what they can do on certain shoulder exercises, but I also tell them what machines you got to stay away from. And unfortunately, either people try those on their own, or maybe a trainer just has them do it and they end up hurting themselves. So I just feel like I can give them that extra bit of expertise when it comes to helping them, and even with their diet too. Having been involved in bodybuilding, and with bodybuilding, your goal was to drop weight as quick as possible, drop your fat and everything. Of course, now we're talking about the Chiro Thin program is a great way for a weight loss, but just having that background prior to this in how to drop weight and bodybuild helps me to help them also get stronger, get leaner, and avoid injuries, because I've been through every injury in all my careers, being bodybuilding and in going to all the gyms. I probably done everything wrong, in the beginning. I was doing heavy squats, killing my back, deadlifts and things like that, heavy bench presses. And so I learned from my own mistakes, and I learned from my own little injuries way back when what to do and what not to do. So I like to use my background, my expertise, and my uh, awareness of how to prevent those kind of things, and then impart that knowledge that I have from my own benefit that I've used, and impart that to them so that they can hopefully prevent injuries, but yet still work out like they want to, develop the body that they want to. And the ChiroThin program just kind of fit into all of this
Right
now
in
with,
there.
with helping with weight loss and everything. So I just am very, very excited when I work with people, because I can give them that extra element of not just looking at their back, but saying, hey, let's see what we can do to prevent this from happening, or limit, the damage that could happen if you're doing something with it. And you know what, let's maybe talk about something as far as your diet and that kind of thing, because we know that when we are overweight or obese, it affects our back, it affects our hips, it affects joints. And
Right.
again, we've talked about the systemic things that it affects, but obviously musculoskeletal things get directly affected with that. So it's just this whole body component, nutritional and physical, and all those things that we try to work with, all for the benefit of the patient. And I love doing it.
And you're really good at doing it. I like what you said, whole body health. All right, well, Dr. Terry, everybody is waiting to hear about the Olympics. So you have been to the Olympics as a chiropractor doctor.
Yes.
You were there.
Yeah.
And you've also had experiences at other competitions and things.
Mm-hmm.
But we want to hear about the Olympics. How did that happen?
Mm-hmm.
Which Olympics which athletes did you work on, and how did they find you? So
Right.
enlighten us.
Yeah. So when the Olympics came to the Summer Olympics in '96 came to Atlanta, and so I thought, hey, it's here in the country. I've
Yep.
always wanted to go to the Olympics, and being involved in sports, I've always enjoyed watching the Olympics on TV. And so when I found out the Summer Olympics were going to be held in Atlanta, I contacted the American Chiropractic Association, and I said, hey, I would love to be able to volunteer my services for this, and is there availability? And they said, well, let's see what we can do, because it's a process, to be selected for that, and asked to be able to do that. So I waited and waited, and I hadn't heard anything. And then finally I got a call from the American Chiropractic Association. They said, yes, you can volunteer, you can be down there, but we've got 3 weeks to go to the games. And I had not, because I didn't know if I was going to be, allowed or selected to go and work down there. I had no idea where to stay, and everything had been booked up for a year before that, all the hotels and everything. And so nothing was available. So I thought, oh, here I have the opportunity, but I'm not going to be able to do it because I have no place to stay. So I contacted the American Chiropractic Association, and they put my name out that Dr. Drassal is looking if anyone knows of some place to stay, if any chiropractors in Atlanta area. And it turned out there was a chiropractor that lived in Atlanta, and he got my contact information. He called me and he says, you're lucky because I have a huge house. He says, I've already rented out I got one room left. And I said, put me there. That's where I want to do that. So that was a blessing, and I was able to finally get some place to stay. So good, I had the place to stay. I was all set to go too. And so I was able to go to Atlanta, and it was really, really fun. And what they do there when you are volunteering, like say as a doctor or medical professional or any kind of a volunteer like that, is you can't necessarily pick and choose, what areas you want to be in, like, oh, I'd like to be with gymnastics or some of the high profile things like that. So they put me in the arena where there would be things like karate and weightlifting and judo and table tennis and squash, some of those kind of things as well. And I have a background in table tennis, which a lot of people didn't know about too. But I have a background in table tennis. I used to compete and still do today. And so the table tennis really intrigued me. And so basically, I was put in the venue that had the table tennis in there. I could still go to some of the other venues, but I was able to go to that venue where they had table tennis. So having played table tennis and being involved and seeing at that time all the videos of the world's best players on video from China and from Asia and that kind of thing, all of a sudden now I'm seeing them in person. And
Wow.
yeah, so I'm seeing all the best players in the world. And honestly, the US, unfortunately, is not the best table tennis players in the world, but we're in the top 20 or something like that. But anyway, so I was then given the opportunity to help our players and do that. And so chiropractic fits in really good with athletics because, again, we're talking about movement, restoring movement. And so what happens when athletes are, they're doing movement all the time. And so they would come to me, they'd say, hey, can you check my back out or this kind of thing? And so really what I was doing the majority of the time is I was basically stretching them out. I was giving them tune-ups. I was getting them ready for their matches that they had to do, whether it was table tennis or karate or something like that. And so I was lucky I had a portable table that I brought
Yeah.
down and things like that. So I could work with these athletes and the US team was very kind. They said, please help us out and everything. So I got to work with them mainly. And so I would work with the men and the women table tennis players for the US and then got a chance to meet some other ones from around the world. But basically, it was just a great experience because I could get them ready for their matches. And then they also had access to me afterwards where they could come visit me and then we could work some more on some things and get them tuned up and ready to go for their competitions. But just being in the atmosphere, being in that own atmosphere too. And so we got to go then to the Olympic Stadium at that point, and it was great. And that was the one where Muhammad Ali uh, lit the torch.
Oh,
And so, yeah, and so he got up there and lit the torch and everything. And so it was just a tremendous experience. And so being involved with the Olympics it was like a once in a lifetime opportunity. And I was so fortunate to be able to be chosen to do that and everything. And so it's just a great experience. And then that kind of parlayed into then when I worked with the table tennis groups, they said, you know what, we would love you to be our team doctor at our world championships. So when the men and women's national teams would go across, in fact, so one was in Kuala Lumpur, Malaysia. So I went to work with the team there. The other one was Eindhoven in the Netherlands. So when the World Championships took place, they took me with, and I was able to, again, do the same thing. Kind of, they had access to me at the hotel room. I could work on there. I had my table. I had an ultrasound machine. I had all that. And so I was able to work that. And then when we got down to the playing arena, I could do some stretching for them, some pre-stretches, get them ready. After their event, I could check them out, maybe, do some post stretching as well as like that. So it was just fun. And so just being in that whole atmosphere and just being considered the doctor for the team was it was quite an honor and just an experience. Yeah. So it was just a fantastic time.
and I like how you said that you were honored, but you were also chosen. So it wasn't everybody that gets to go and do that. You had to be chosen. So that means you got to be good at what you do. And with all the additional expertise that you have in education, it was a natural fit. How fun. But now we want to hear about
Oh, the bodybuilding. Oh,
way to the beach.
right. Yeah. Yeah. Yep. And so for me, I was the skinny kid in high school. I was a kid you could see. You didn't have to take speaking of x-rays and chiropractic, you didn't have to take x-rays. You could see the bones in my spine. That's about how skinny I was. But I did sports and everything, but I always felt like I was just skinny and I wanted to get bigger and everything. So after high school, then I started to work out at a gym and work out with weights and everything. And I started to gain muscle, and it was like, wow, I really like this. I'm not that skinny twerp anymore. And so it was physically great, but it was also mentally great because it was like it's like a confidence builder when someone is so thin and everything. So I started working out, and I really enjoyed it, and my body responded well to it. And so I found myself, just gaining more muscle and enjoying, just the feeling of being stronger and healthier, things like that. So then as years go by, then I thought, you know what, especially now I'm in chiropractic, I'm doing that. Maybe now, why don't I compete in bodybuilding?
Sure.
Yeah. And so I thought, why not do something like that? I had gone to see some shows and everything. And so I remember the very first show that I did, my brother that I practiced with, his wife said, "Hey, we should do this show." It was going to be the very first bodybuilding show. They were holding bodybuilding contests around the country at this time. They had national shows and everything. But it was the first time they ever had a mixed pairs event. It was always men's, women, and the division, and the men's and women's divisions, but they never had the mixed pairs. So finally, mixed pairs competition was starting to flourish across the country. But for the first time, Minnesota was going to have it. And so,
Cool.
so I talked to my sister-in-law and I said, "Should we do this?" And she said, "Let's do that." And so we ended up, training hard and everything, and it was called the Twin Cities Bodybuilding Championships. And so we went and competed in that. And part of it is you do a routine to music. And so I made up this routine to music, and so we would do certain things, and we ended up winning. So that was the thing. So yeah, so we won. So it was our first show ever, and we ended up, winning the show and on all that. And so it was just a great experience. And so that really got me pumped up, if I can use that word. Yeah, literally pumped up.
Literally.
Yeah, to do more competitions. And so from that point on, then I ended up, doing a few more competitions and training. Then there was another mixed pairs event, and by this time my brother's wife had gotten into running, some other stuff, so she wasn't available to do that. But then we had another person that is a patient at the office, and our body types fit very well. We were both kind of a little taller and leaner and everything, so we got really good. And she says, "Let's do this." And so we ended up training, doing the same thing, and then making up a routine to it, and we ended up winning that one too. So it was really fun. So we won the Twin City Bodybuilding Championships. The other one was the North American bodybuilding championship. So we ended up, winning that one as well. So it was just really, really a fun experience. But I learned a lot about dieting and what to do and what not to do.
Right.
And of course, my knowledge now is so much more than when I had back then. But it was very, very interesting to watch the body change, and as you lose body fat and you keep the muscle on and everything, to go through this. So I learned a lot about nutrition. I learned a lot about weight training and exercise through that. So that kind of experience, again, helps me with patients that I have. Whether it doesn't mean that they necessarily compete, but I did end up seeing a lot of the bodybuilding people that I know at the gym would come to see me for their backs or their necks or whatever it was, and that kind of thing. But again, that just helped me to help my patients that maybe go to a gym and work out. And when they say, "Well, you know what? I hurt my back, I hurt my shoulder. I was doing these lat pull downs." You know what the lat pull down machine is, and they're showing me how they're doing it and everything. And I'm thinking, that's the exact wrong way to do it. You never do it behind your neck. And so it's just these little nuances, because I had the knowledge of what I'd been through, and I'd tweaked my neck, my back. I'd had these little injuries in the past, and I'd learned from that. So then I could use that knowledge, to tell them what to do the correct way. So that just kind of morphed into having more and more of these patients that were bodybuilders, because they knew that I was into it, and so they knew what I was talking about and everything. And so then it helped out. It just kind of went from there and built from that part. And then I was fortunate to where the Chiropractic Association was knew about me and the sports and the things like that, and they asked me to do some segments on some of the local channels about proper ways to snow shovel and proper ways to rake leaves and things like that. And so I was able to be on some of the newscasts and showing little segments on how to do this and how to do that and preventing injuries and things like that. And so it really, really was fun to be able to use that expertise. So I've been blessed in that, just with the things I've been involved with, I've been able to use my knowledge ideally to help my patients and hopefully get them feeling better and giving them a better life, quality of life.
And as we close out this section, I just have to look at everybody and say, Dr. Terry is here to pump you up. Dr. Terry, what is this and why am I holding it? It is slimy, it is heavy, it is ugly, and I don't want it. What is it?
Believe it or not, Pamela, this is 5 pounds of fat. So this is what basically pretty close to what it looks like, the substance of it, everything too. But when you tell people, especially when they're dieting and losing weight, you're saying, and if they've gone down 5 pounds, you say, hey, you're just taking this off of your body. Or if
My God.
you've lost 10 pounds, you've taken, two of these.
So I got rid of 4 of those.
You did. Yes. Yeah.
Wow.
You don't want them to come back either.
No.
So
How ugly and gross is that?
yeah. But it's a very visual thing. When people see it, they go, oh my gosh, it just does not look good at all and everything. But it's kind of a very strong impression though that it gives, because they realize what 5 pounds, looks like and everything
Feels
like
like.
that. Yeah.
It's slimy.
Yeah.
It's gross.
Right. So
I'm just gonna leave it there.
yeah. And so when we're speaking of body fat, when we do that, when a patient does decide to go through the Chiro Thin program at our office, one of the things we do is we always meet with them once a week. So the doctor supervisor meeting with me, and as part of that meeting,
Put that out in front of them.
yeah, here, you're going to lose this and more than that, like that. Right, exactly. Yeah, and that's motivation right there for them to do that too. But basically, when they come in, it comes with 3 different booklets. This is the instruction manual that goes through everything that's on the program. It's very, very, very easy and basic to read everything. They have a food journal, and what they do there, and this, is that they're going to fill that out. And so when they bring that in with them, I can see, what they've eaten during the week. If they have questions on, hey, should I do this or that? So we answer those questions and everything. And then finally, the third one is, it's actually got a recipe guide for some people
there's some good recipes.
Yeah. So for some people that are looking for some additional foods, they've got a program that they like or some things that they're eating, but maybe they want some variation. It's got some great recipes in there, and they're all fine to be included in the program. They all work with the program. They're all low glycemic index, anti-inflammatory foods, but they're tasty. This whole program, you're eating real food. It's tasty. You can make it as great as you want it with the seasoning, flavoring it up, that kind of thing too as well. And like I say, there's a wealth of vegetables and fruits. This isn't just limited to just a couple of different vegetables and fruits you have and get boring like that. No, the list goes on. And then there's vegetables that you can have as much as you want of. You remember, they call it the free vegetables, and you can throw those in as well and everything. So there's really, really no excuse for people to be hungry on this, because there's times when, especially if I'm adding some of the vegetables that are the free ones and throwing them into what I've got already, it's like, I can't believe I have to eat all this stuff. Yeah, it was amazing. So anyway, so that's part of the program. And again, the big key is the nutritional formulation, the Chiro Thin formulation. This is a product that Chiro Nutraceutical, who makes this, I was very impressed with this. When the pandemic hit us last year and everything, and of course everyone was trying to, whether you want to get inoculated or not or whatever, that's not for discussion here. But anyway, people were trying to get their immune systems built up as much as they could to be hopefully not contracting this horrible COVID. So I saw this product. It's called Immune Support, and it was from the same company that makes this. They have a number of different products out there, and I had never seen something quite like that. And what it is it's got 21 different nutrients, vitamins, minerals, lots of herbs that are specially formulated to kind of bump up our immune system. So I thought, you know what, I'm going to take it, especially with what's going on in the world right now. We need to do that too. And so I was taking that, and I have continued to take it. And honestly, and again, I can't say, I didn't get COVID because of it or anything, but I know it had to help me, because I didn't have any colds, no flus, no sickness or anything like that too. So I'm a real proponent of it. And especially, like I say, in this day and age when we're trying to be so careful and people are trying to avoid getting sick, and with this whole COVID thing too, anything that we can do to bump up our immune system. And that goes into, again, drinking water, exercising, all those things go hand in hand. But from a nutritional standpoint, I guess I haven't seen a product that had all of these elements in it as one. So I was really sold on it, and I've had a lot of patients that have used it. And like I say, I use it personally. It's a great product, and if they're interested in it, they can always, get some from us if we wanted to.
When I was just overcoming COVID,
yeah,
you had suggested that product for me.
Yeah.
And I took it, and it made a big difference in my lungs. It helped with that whole process of clearing things up. So that was definitely a
good.
success tool
Yeah.
for me.
Yep. So if someone does go on the program, and we talked about how they meet with me once a week for that, well, what does that include, that once a week? So once a week when they come in, what we do is we take some body measurements and see how those are doing. And typically people are losing inches, things
Yes.
like that. But then we also do a body composition analysis. And that's where we're testing on a machine that I have where we're testing their body fat. And so we basically, it's a form like this that we fill out every time they come in, every week that they come in, and it will show their body weight, their current body weight, but it shows their body fat percent. And we can see as that starts to go down, it'll show the body water. So we really want to hydrate when we're on this. What happens is as we burn fat, as our bodies metabolize fat, it releases toxins. Toxins tend to get built up in fatty tissue. And so when we start burning that fat, now think about it, those toxins have to be released into our bloodstream. So we want to hydrate. We want to make sure we're flushing that out of there too. And so that's something that shows up on here, how well they're hydrating as well. It shows us the muscle mass, how much muscle that they are carrying on their body. It shows us, it gives a little rating on their physique as far as now that they're dropping body weight, where they're landing in a physique rating. It shows us our bone mass. Now the bone mass, it's an interesting statistic to see. It won't change that really that much with this kind of thing, but it's nice to see just in case someone maybe is osteoporotic and they haven't been tested for it. This would kind of show, we find a range that was very low, and we'd talk to them about that as well. So it does show the bone mass. And then it shows your basal metabolic rate. And so that is at rest when we're not exercising, working out, nothing like that, how many calories a day it takes to maintain your current body weight. And so it does show us that number because that's a good number to see. And based upon all of these different items on here, it will determine what they call your metabolic age. So not your chronological age, but your metabolic age, which is really what, okay, based upon your age, your body fat, your muscle mass, your this, and that kind of thing. Yeah, it'll do that. So for some people, it might bum them out a little bit because it might end up being older than what their chronological age is. And so we like to, if it's that case, we watch that go down. So that's kind of an exciting
Which is
thing.
fun.
Yes, that kind of
That
thing.
was
So
really fun for me.
yeah, so if somebody is 40 years old in the program, but according to their body fat and everything else that they have, maybe they're 60 years old with their metabolic age. As they're progressing in the program, as they're getting more energy, they're losing weight, they're feeling better, we see that number come down. And that's what I noticed for myself. So I kept watching my numbers go down. I go, this is really fun, that kind of
Yes.
thing too. Now, I was in a position where even when I started, I actually was a little bit younger than what my age was. So I was happy about that. I was like, you know what? I've led a good lifestyle and did that. But most people are going to be higher normally than that. But I watched it and it was really fun because at my lowest point, like I said, doing this program, I lost almost 30 pounds and got to a body fat percentage that I hadn't been at since I was competing in bodybuilding a long time ago too. It had my age down into the teens. So I became a teenager at that point. But it was fun just watching it go down. And so people get excited about that too, and they can watch that age level goes down. But anyway, so that's once a week. We check all that. We take measurements. We talk to them, and we look through the book and see what they've written down, watch their diet plans. If they have some questions or concerns, we get over those kind of things. So it's all included. And as far as I know, it's the only program that really is doctor supervised, where you're meeting with a doctor and going through things and that. And again, it's real foods
It is.
yeah, and it's really basically, if you think about it, it's like this. It's doctor supervised. It includes 6 follow-up weekly visits that you're having. It's safe. They've had actually over 200,000 people that have gone through this program since it started on there too. The company that manufactures this, they're registered with the FDA. Your weight loss is fast. It's predictable. It's easy to follow. It's using real foods like I talked about that you can get in the grocery store. And we give you strategies for long-term maintenance and weight loss and maintaining that weight that you feel so good at now, and how to keep that off and just maintain a healthy lifestyle.
And visuals.
Yes. And
Yeah.
this lump right here. having that off.
Having that off is going to
Yeah.
change your life.
Right.
Well, Dr. Terry, thank you so much for being with us and for sharing all of this knowledge. Hasn't this been amazing? And how do you reach out to him? It's in the description. And you know what? If you're thinking, boy, I would sure love to get involved in the Chiro Within program with Dr. Terry, but hey, I live someplace else. Don't hesitate to reach out to him. Reach out to him, go to his website, give him a call anyways, because he can probably work with you or direct you to who can work with you where you're at. So don't hesitate to reach out. I want to make sure that I say that. And I know that this visual here, which you saw how disgusted I was by it, I have to touch it. It's slimy. You know what? Listen, we want to be the best health that we can be. There is a reason why you are here. Your story matters, your voice matters, your life matters. There are people's lives hanging in the balance waiting to hear from you. Don't let neglecting your health stop you from getting done what you were put on this earth to do. That's why I brought my friend and doctor on here to talk to you today. I wanted to give you all of the wealth of information that you could possibly have so that you could make quality decisions for your life. There are people that love you. There are people that need you. You are here on purpose, with a purpose, by design. Thank you so much for coming and being a part of the Pamela Show today. You're amazing. And remember, go on out there now and be the salt and the light everywhere you go. We'll see you next time.
Ascend Above the Crowd is the newest course by Pamela Hinkle. Ascend is a self-paced email course that will come directly to your inbox and will change your mindset and your life. Each week, you will receive lessons, resources, challenges, and journal writings that will help you discover your purpose by design. It's your time to ascend above the crowd. To learn more about Ascend, go to www.purposewithpamela.com/ascend.
Pamela Hinkle is the founder of the Purpose Center. Pamela is a mindset mentor, author, speaker, minister, and transformation coach. Her weekly podcast, international radio show, and television show are a lifeline that changes lives and inspires people to discover their individual potential through realizing their purpose by design. Pamela is a natural motivator and has shown many how to find their niche and transform their lives. Although success is an uphill battle, Pamela gives the necessary strategies to flourish, cheering you on every step of the way. Pamela shares from her personal experiences, education, and life as a woman in leadership, utilizing decades of knowledge. Taking the approach of, let's have coffee and chat, she will awaken your dreams and purpose by design. Are you ready for Pamela to help guide you? Email us at purposewpamela.office@gmail.com or go to her website at purposewithpamela.com.